Testing, testing, testing. Testing. Sorry, I didn't get your things printed yet.
That's okay. I have lecture right now, and then after lecture, I have 15 minutes for that.
Yeah, I'll have them done before that. I got lecture now too.
Do you know what room I should do all of that in? For chest tube and section and all that?
Normally you just hang out in 240, right?
Yeah.
Yeah, but we can't do that. Who else is
Not
here
fair.
today?
Huh?
Who else is here today? 104. Look. What, I'm supposed to add just you?
It's hot in here.
Oh, you're crazy. It's a crazy day.
Oh my god, I don't understand. I should take much. I don't know if I'm trying to pass the fitness now or if I just totally knocked out. And I keep having spasms here. And I keep going like this to the floor. And I passed, that would be my third stone if I'm passing it. Yeah. You did two on our own board, right there.
Right, people got
10. Yeah. And then you can go out over here.
All right. Hang on a minute. Let's start. All right, I'll help you move stuff down there later.
Okay, sounds good.
Sounds like a plan to me.
Good morning, Professor Nova.
Good morning, everyone. How's everybody today?
Good morning.
So excited, I can tell. Wake up! It's gonna be a long 3 hours if you guys are like this all day. Oh my goodness, I got 10,000 emails here. All right. So I sent an email out to most of you that said that you were having a meeting today with Dean Swellenberger and Professor Gibbs, or President Gibbs. And that meeting will happen at some point during this class. It's a group meeting, okay? So they want to come in and reinforce what you guys need to be doing. So when they come in, we'll let them in. Get everybody in here.
Good morning, Professor Nova.
Good morning. How are you feeling?
Vice God.
Okay. Hi, Heather.
Hello.
Good morning, Charles. And Salamatu and Gady and Arjanique and Sharita. Good morning, everybody. I like to see your faces. Could we please see the cameras on?
Morning.
Pull this over here so I can see you guys. All right. So chapter 33, are you guys ready for the quiz? There are 5 math problems and 5 multiple choice. So go to your course summary. You're going to go to course quiz 4 on Tuesday, February 23rd. Open it up. Minanatu and Davina, I need your cameras on or you cannot take your quiz. There's everybody. No, you can't find it yet. Let me publish it. Now you can refresh and find your quiz. Davina, could you put your camera down a little bit so I can at least see what you're doing? Your ceiling is not very interesting. Jessica, can I see your computer?
Did you give out the code, Professor?
Not yet. I'm waiting for everybody to get organized here. All right, are you ready? The code is good luck, all lowercase, all one word. GOODLUCK. You have 15 minutes to take this quiz.
What was the password again, Professor?
Good luck.
you.
GOODLUCK.
Thank you.
Charles, where did you go to? Okay. Looks like just about everybody's done. All righty. So we're going to do things a little bit differently today. I am not going to use PowerPoints. Your PowerPoints are still in your reading material for this week. You can pull them up. You can print them off. You can study off of them. But today we're going to start using the book. Okay, and we're just going to talk about the content of the material. All right. So, where'd my book go? I'm going to start with chapter 33. We're going to do a quick review of chapter 33 because your exam next week, is it next week? It is next week, will be on chapter 33 and chapter 34. So that means you're going to have to know all that pharmacology terms and things like that in order to pass this exam. So let's review. In chapter 33, and that is on page starts on page 622. All right. Sharita, Davina, and Hani, I would like to see your beautiful faces. Helps me when you come into campus, I can kind of recognize you. Yes, I see you grinning. All right. So, chapter 33, pharmacology and preparation for drug administration. Let's look at these key terms here. Who remembers what agonist means?
Is a drug that produces a response?
Yes, agonist means that things happen to the cells, that there is a response. And so antagonist is what?
It blocks
When
the
it blocks it.
It blocks the response. It stops the response from happening. Very good. A black box warning. What's the significance of a black box warning?
Like letting you know all the side effects that come with the.
Okay, but why do we have some drugs with a black box warning and some that don't? I mean, if I was taking a drug with a black box warning, would I be more concerned?
Yes.
Yeah, because a black box warning, if you look on page 628, is the strongest warning the FDA can give. Okay, the strongest warning by the Food and Drug Administration that a medication can carry and remain on the market in the United States. So that's the highest level of concern for the drug. Anything over that, we can't have on the market in the United States, okay? So a black box warning is the strongest warning by the FDA. What's half-life?
Is it the amount of time that the drug stays in
The
your system?
amount of time. Yeah.
Okay, and what's the significance of that? Why do they need to know what half-life is?
To know when to give another one.
Very good, very good. Because if the drug is half of gone in your body, we need to get more drugs back in to remain at a level that is therapeutic, right? We want to stay at that therapeutic level. What happens if we go above the therapeutic level?
Toxicity.
Toxicity, yes. Toxicity is not a good thing, right? So what is the peak action?
When the drug works its best, like when it's, am I right?
Right, you are. It's when we have the highest amount of the drug in the system. Okay, that's the peak. What's the difference between pharmacodynamics and pharmacokinetics? You guys are doing good. Pharmacodynamics and pharmacokinetics.
Pharmacodynamic is the study of the drug.
The dynamics,
Uh-huh.
okay. What's the kinetics?
Drugs they used to treat and diagnose and cure.
Okay, so when I'm talking pharmacokinetics, what am I talking about? What are
So
the
like
four things?
how drug enters the body?
How it enters the body, yes. So how it moves through the body. So there's four things that happen in pharmacokinetics. What are they?
Absorption,
Absorption. What happens after it gets absorbed?
degrade,
After it gets absorbed, what happens?
Distribution,
Distribution, and then what happens?
metabolize,
You don't know? What's the third
Meta-
one?
Is it metabolized and then excreted?
Metabolized and then excreted, yes. That's how your drugs move through your body. All right, which one is the quickest to absorb? Very good, Alexis. Which one's the quickest? You think of all the different ways we can give drugs. Which one's the fastest?
IV,
IV, yes. And if IV is not on the list, which fastest after that?
Subcutaneous?
The respiratory,
What'd you say, Katie?
the respiratory drug.
Respiratory, okay, respiratory is pretty quick. Also sublingual, anything that's going through the mucous membranes is much quicker, all right? Good job. Synergistic effect. What does that mean?
When two drugs are combined, it's the effect they have on the body.
Right, that when we combine two different drugs, the effect they have separately, it is greater when I combine them, okay? So this is why we have medication that has oxycodone and Tylenol together, because separately they each have their own job, right? But when I put them together, they work so much better. So synergistic means that they work together. We already talked about therapeutic range. All right. Table 33-2. Which I know we didn't spend a whole lot of time on this, but you will see questions about this table on the test, okay? So drugs can be classified by their action. And you'll see today when we go into Swift River and start doing the med pass, that they want to know what classification this drug is in. So this list here will help you immensely to answer those questions. But you should know, you know, what an anticoagulant does. What is an anticoagulant? What does it do?
Clots the blood.
No, it's an
Blood
anticoagulant.
thinner.
Thin blood thinner.
Yeah, it's a blood thinner. It keeps the blood from clotting, right? What is a diuretic?
Water pill.
It's a water pill. And what does it make your body do?
Urinate.
And water.
Get rid of the water, right? Get rid of the excess. They use it for hypertension. They use it for edema. They use it for a lot of different things. They use it for high electrolytes, all right? Your emotional and mental status drugs, those are basically your psych drugs. Neurological drugs are your opioids, your pain pills, because they work on the neurological system. Endocrine are hormones, insulin, hypoglycemics, things like that. GI drugs are pretty standard. Most of them are over the counter. Just remember that an anticholinergic drug, and it's down there at the bottom of the table on page 624. Anticholinergic dries everything up. Okay. It reduces secretions, it reduces spasms, it gives you a dry mouth, it gives you dry eyes, it causes constipation, it dries everything up.
What drug was that?
Anticholinergics. Okay. So that's how we're going to use that table. You know the schedule of controlled drugs. Which drugs would fall into Schedule 1?
Like oxycodone, oxycontin.
No, OxyContin's a Schedule 2. Which one's Schedule 1?
Like
Heroin.
potential for abuse.
Heroin, yes.
Oh.
Things that we don't necessarily give to people. All right, or you won't be giving them to them. What are the standards that the manufacturers have to meet in order for the FDA to approve the drug?
Safety, packaging, drug quality.
Okay, but let's look at table 33.4. There's 5 specific things there.
Purity, potency, bioavailability, efficacy, and safety.
Yes, those are the 5 things that the drugs have to pass, the 5 tests that the drugs need to pass in order for the manufacturer to put them out on the market. Okay. What's the difference between a side effect and an adverse effect?
Is a side effect something that's expected?
Very good, yes. We expect side effects. We do not expect adverse effects. So, like on your quiz today, we had a question about somebody we gave an antihypertensive to and their blood pressure lowered and they got dizzy. And another one we gave an antibiotic to and they had a rash and were having trouble breathing. Right? Which one was the adverse effect?
The rash and the trouble breathing.
The rash and the trouble breathing. Yes, that was more important because we weren't expecting that. Okay. All right, 6 rights of medication administration. What are they?
right dose, right patient, right route, right time.
Documentation.
What are you giving?
Medication.
Right medicine,
Medication.
right document.
Right. So if you think about your physician order, you need to have the right patient. You need to have a drug name, right? So the right drug, the right dose, the right time, the right route, and the right documentation. Okay. Think about what you need to include in an order, and that'll help you with the 6 rights. Just remember, if you do make a med error, you need to report it. You cannot hide it because it's all about patient safety. Okay. When we're talking about an older adult with chronic medical problems, what do we need to consider for the dosages?
Lowering it.
Need to lower it. Why?
She might be on another medication. Maybe taking
Right.
that.
They're on multiple medications.
The
And what's going on in their body? Say again?
The metabolism has slowed down.
Their metabolism is slowed down. You know, their liver may not be working very well. Their kidneys may not be working very well. And so the drugs will stay in the system because they're not getting broken down, which causes toxicity. What about children and infants? What do we do with them? How do we dose them?
By their weight.
By their weight.
By their weight, yes, by their size and their weight. Okay. Make sure that you read the nursing process for giving medications, starting on page 634. The application of the nursing process, it's got lots of good information in there. All righty. Move on to chapter 34. This chapter is about administering oral, topical, and inhalant medications. So anything that does not get injected is part of this chapter. All right. What is your responsibility when you're administering medication? Arjanique, you're muted. I can't hear you.
Patient safety.
Patient safety. And how do we know we're being safe?
6 rights.
6 rights. That's a good one.
Standard
What else do
precaution.
you need to know about that medication?
Side effect.
Expiration date.
You know side effects.
Make sure they're not allergic.
Make sure they're not very good. Allergies are very important.
If it reacts with any other medicines they're on.
Very good. That's a good one. It's a couple more. How about why they're on the medicine? Do they actually have a diagnosis that goes along with this medicine? Okay, because a lot of times, you know, people just keep taking and taking and taking, and they really don't need it anymore, right? Or there's a med error when they're transcribing and it doesn't make sense for this patient. So you need to know that the medication is appropriate and that the dosage is appropriate for your patient. Where are you going to find that information?
On their history?
I wouldn't trust their history. I don't know if I have one or not. You guys, on that big stack of books you got, you had a drug book. If you have any drugs that you are not familiar with, you have to look them up to make sure they're safe for your patient. And in that drug book, it's going to tell you why they use that drug, the usual dosage, what you have to watch out for, any adverse effects, any side effects, okay? Any nursing considerations on how we give that med. Okay, so before you give a med that you are not familiar with, we don't guess and we don't say, I'll look it up later. You look it up before you give the med. That's how we keep our patients safe. And then after we give the med, we have to make sure that the med's working. There's no sense in giving a med that's not working. If you have somebody with an infection and they, you know, we've been giving them antibiotics for 6 days and they're not getting any better, is that a good medicine to be giving to that patient? No, you want to call the doctor and say, hey, this isn't working. We need something else. All right. So your safe medication guidelines on box 34.1, very important for you to know. We talked about medication orders in math the other day, what needs to be in an order, right? And the meaning of the order. So that leads us to our abbreviations. You guys study your abbreviations? You're going to find out soon. I'm going to do a little Kahoot here in a little bit. Okay, so there's different kinds of orders. There's the routine or scheduled order. Those are the pills you're going to give every day at a specific time. What is a PRN order?
As needed.
As needed, yes. Okay. And when you have a PRN order, what do you need to have in that PRN order?
What it's for, like why they are getting it.
Why we're going to give it. Very good. Yes, you can't just decide, well, I think they need this med. No, there's got to be a reason for it. Okay. A stat order, when is that?
Right away.
Immediately.
ASAP.
Don't stop. Give it right now. Within 15 minutes of getting the order, you need to give that med. Hopefully sooner, because usually they have an emergency box somewhere you can give that med out of. Okay. Some units have orders that are kind of like standing orders, that if you see this, this is what you do. You have an order to give at one time so that we can get hold of the doctor. So I've worked in plenty of nursing facilities, and like in flu season, we get a sheet of standing orders from the physicians to say if their temperature is over 100.4, you can give Tylenol, we can start Tamiflu, we can give Robitussin to take care of the flu symptoms and signs and symptoms of the flu without having to call the doctor every 5 minutes when a new person gets the flu. Okay, so that's kind of like the protocol orders that they're talking about. Some meds need to be checked and double checked. Who can think of some meds that need to be double checked before your dosage needs to be double checked before you can give it?
In medications?
Pain medications. Yes, especially injectables. Okay, you need to have a second nurse check them. Insulin, you need to have a second nurse check them. Okay, in order to make sure we're giving the proper dose. All right, routes of topical medications. Let's see, did I hit everything on my list here? So routes of oral medication, that's PO, right? Medication that goes down a gastric tube or a G tube or a PEG tube is also an oral medication because it's going through the GI tract. Okay. If you have people who are having trouble swallowing their pills, then if the pills are crushable, which pills are not crushable?
Enteric coated.
Enteric coated. What else?
Capsule.
What other kind of meds?
Capsules.
All right, capsules. What else? Some capsules you can open up. What are the initials at the ends? Mhm.
Can I just, you steady trying to take this from me?
But to me, like the extended release and immediate release.
Right, extended release, immediate release we are okay with, but extended release, sustained release, long lasting, those are all drugs that we cannot crush, okay? Because that'll give them all that med at the same time, as opposed to being let out slowly as they go through the system, all right? So you cannot crush those, you cannot crush enteric coated medications, and most capsules you cannot open, but some you can, you have to ask the pharmacist, okay? So once we do have meds we can crush, we need to crush them up real fine. We need to put them in a little bit of applesauce or pudding or jelly or whatever the patient likes. Mask the taste because the taste is usually pretty bad once we crush it up. And then we give it to them. Do not put a ton of applesauce in a cup for one pill, okay? Because they have to eat everything you put the pills in. All right, so one mouthful is enough. We don't need to have several mouthfuls of applesauce to get the medication in. If you're putting it down a G tube, you're going to dissolve the medication in water as much as you can. Some of them don't dissolve very well. And then we're going to flush the tube before we start with 30 milliliters of water. Give each med separately. We don't cocktail the meds. Each med separately. After you give a med, you're going to flush it with 30 milliliters of water. Give the other med, flush it with 30 milliliters of water. At the end, you're going to flush it with 30 to 60 milliliters of water. All that fluid that we just put down that G tube needs to be counted on your intake. Okay. Other meds that should not be crushed, your sublingual medications, the ones they put under your tongue or in your buccal medications, we shouldn't crush those either because they're going to absorb fast enough in their whole form and they don't have to swallow anything. We never swallow those, so we just let those dissolve. Topical medications. Topical medications are more than just lotions and ointments. Topical medication is anything that's going to sit on top of a surface. So eye drops, ear drops, suppositories, respiratory drugs. Those are all topical medications. Okay, so don't get stuck in the fact that it's just a lotion that's a topical. All right. So when we're talking, say again.
Sorry, I had a question. On the
Yeah.
quiz, it was saying for topical medication, what is one of the first things that like you want to watch for? I mean, I think it was like watch for, like, make sure that they're wearing sunscreen or, I forget what the question was, but I really didn't make sure to answer.
Let me look up. Okay, the one about the NSAIDs?
I think so.
Okay, an older adult is taking non-steroidal anti-inflammatory drugs for arthritis on a continuing basis. Which assessment question is most relevant? What do NSAIDs do to a patient's stomach? You ever take Advil on an empty stomach and get upset stomach?
It's really hard on the stomach.
It's very hard on the stomach. So we are going to ask, have they had noticed any dark discoloration of the stool, because we're looking for blood. Okay, NSAIDs cause GI bleeds. That's the answer to that question.
Okay.
All right, so eye and ear drops. OTIC, OTIC. I'm gonna put it in the chat. OTIC is for your ear. Okay, any drug labeled OTIC is for your ear. Any drug labeled optic is for your eye. And they should be labeled clearly on the bottles, whether they're OTIC or optic, or OTIC or for ophthalmology. Okay. We don't want to put eye drops in ears and eardrops in eyes. The other thing you may run up against when we're talking about eye drops, eardrops, is that some doctors will abbreviate right and left differently. So when we're talking about your eyes, we would start with OD, caps, okay. OD equals right eye. Okay. OS is your left eye. And OU is both eyes. Okay, because sometimes they'll order the medicine for just one eye. Sometimes you'll have different medicines for each eye. So you have to pay attention to what they are telling you, where they're telling you to put the meds. Okay. When we're talking about ears, we're using the D and the S and the U. Okay, but we're using A for oral, AURAL. So AD is right ear. AS is left ear. AU is both ears. Okay, so those are important abbreviations that you're going to need to know. Now they're trying to get away from them, but a lot of doctors are still using them, so you need to know what those are. Other things that are topical, rectal suppositories. Rectal suppositories are topical because they're going to sit up against the mucous membrane of your rectum. So they're laying on top, and they're going to affect the colon based on where they're at. Transdermal medications. These are patches that we put on the skin, and they get absorbed through the skin. So there are hormone patches, there are patches for blood pressure, there are patches for psych drugs, there are patches for pain medication, okay? Heart medication. When you put on a patch, make sure you take off the old patch. You know, don't want to have 2 or 3 nitro patches on somebody. The other thing is when you're using a patch, when you're administering a patch, you want to put gloves on your hands because your hands are covered with skin, right? And so if it's going to absorb into the patient's skin, it's going to absorb into your skin. So be careful what gloves on to put patches on, especially things like nitro and fentanyl, because they are very quickly absorbed into the system. When you're putting on a patch or a transdermal medication, it should be in an intact, hairless area. And we have to rotate the site so you don't put it back on the same spot. You wipe that spot off and you put it on a different spot. So we basically, we rotate from right chest, left back to right back. We can go on arms, we can put it on abdomens, depends on what kind of medication you have. All right. And then inhalants, your respiratory drugs, your multi-dose inhalers, like your albuterol, are and medication that lays on top of the mucous membranes of your bronchioles. So we have corticosteroid drugs that we give inhaled. We give bronchodilators to inhale. We also use meds in their nose to inhale. Okay, so we can use nasal sprays to open up nasal passages. We can use nasal sprays to administer medication. Calcitrol does not work well going through the GI tract, but it absorbs very quickly through your nasal passages. So you can, nasal calcitrol is probably one of those drugs that you're going to give nasally. It's one nares, and you're going to alternate nares. All right. My nose drops good. All right. So those are your topical medications. So when we're administering medications, we got to have some record of these, right? Our record for how we document our medications, our medication administration records. And you're going to see a couple of examples on page 650 and 651. Now, technology has improved the medication administration safety, because if you use it correctly, you're not going to give the wrong drug. All right. A lot of the physicians are putting their orders directly into the patient's charts, so that that's going to the pharmacy, it's going to the MAR, physician orders, they're all in one place. And that saves on A, time, and B, translation problems. Okay, it's very hard to read their physician handwriting sometimes. Barcode scanners, they scan the medication package, they scan the patient, and it'll tell you whether it's the right med at the right time and the right dose. So these MARs that you're looking at on page 650. Just another minute, I'm going to go through this and then we're going to take a break, okay? So the one on page 650 is a paper version of an MAR. There are many, 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 many different versions of this, depending on where you work. Long-term care, usually it's a 30-day MAR. Hospitals are usually 24 hours MAR. This one's a 5-day MAR. And the reason the time periods are shorter is because the theory is that the meds are going to change more frequently, and don't have to have a mess on your MAR and all these extra pages to keep up with it. Okay, in chronic care, your MAR is not going to change very much, so that way they can do a whole 30 days. But on the MAR, and they all have this, you are going to have allergies written up on the top left-hand corner. Their diagnosis should be on the MAR. And then we have the date ordered, the initials of the person transcribing the order onto the MAR, and then the drug name and dose. So this one has digoxin, 0.125 milligrams, furosemide, 20 milligrams, and slow K, 500 milligrams. All right, Those are the 3 drugs. They're going to be given at different times. The digoxin is just QD, once a day. Okay, and it's scheduled for 9 a.m. So if you look over here on 427, I think that says, this nurse, that's her initials, gave that med at 9 a.m. So the time and the initials are there. Also, the apical pulse is there because we never give digoxin unless we take an apical pulse. The apical pulse needs to be greater than 60. Okay? So they got it that morning, they got it the next morning. They should be getting it on the following day, which would be the 29th, the 30th. Okay? The furosemide is twice a day, BID. It is scheduled for 9 and 5. Each facility has their own time schedule. When we're giving meds, you can't give all your meds at 9 o'clock to 20 patients, right? So you have a time frame you need to give these in. In acute care, it's usually 30 minutes before or 30 minutes after. In long-term care, it's generally an hour before or an hour after. So you have that window that you can give your meds in. Outside of that window, you are late, and that's a med error because you're not giving it at the right time. Okay, so this is BID at 9 and 5, and you can see that they have the dose given at 9 is signed off, and the dose given at 5 is signed by a different nurse. And then your slow K, 500 milligrams is TID. Time is 9, 5, and 1. And you see there are 3 different initials in that box. That's a paper one. Everybody, I think, is getting away from the paper ones and going to the electronic ones, which you'll see an example of on page 651. This is a medication administration record. It doesn't have all the bells and whistles on it. Usually in top of the record, it's got the name and the weight and the code status and all kinds of information. But it has the drugs out, separated out based on the type of order it is. We have no stat orders. We have our furosemide tablet. Order started on 10/11. The dose is 20 milligrams. It's oral and it's twice a day. Okay. So we see that we have a 8, I think that says 8. Can't read that. An 8 a.m. dose and a 2100 dose. Okay. The ones that are green are the ones that need to be given now. Once it's given, it's crossed off. Okay. The other thing is we have this action panel on the end. You notice some of them are lit up in green. That means they're time to give it to. You want to stay in the green. If you're getting late, it's going to go to yellow, but you want to stay in the green. Okay. So the digoxin tablet is due now. Okay, you see the green light next to it. And then the PRNs, if it's already been given and it's not time to give it, the light's not going to be green. But it is green for the other 3 because they haven't received those yet. So you see how you're reading your MAR? These drugs that were on this MAR are transcribed from physician orders. So the doctor orders it, it gets transcribed onto an MAR either by hand on the paper one, or the computer will do it.
Digoxin or heart medication?
Digoxin is a heart medication. It slows the heart rate down so that more blood gets in it. So when it pumps, you get more circulation. All right, go ahead and take a 10-minute break. Come back at 10:15. Okay. Good job, guys.
Been here 11 years. They got my job. This day
Okay, time to come back. Hope you enjoyed your break. Cameras on, please. I enjoy seeing your faces. Kante, Amita, Amanita, Sharita, Shamari, Davina, Nananatu. Here we go. People coming back now. It's an interesting picture. Sharita, Davina, Namanatu, are you there?
I'm here.
Okay. I know you're here. All righty. I'll let the other two catch up here in a minute. All right, so medication administration systems. There are 3 different kinds of medication administration. The first one being a stock supply of medication, where all the medications are in a large bottles, and you go in and you take out the medication you need from those bottles. Usually it's things like over the counter, like Tylenol, Advil, calcium, vitamins, those kind of things. Okay. Then there's the individual medication system, where each patient has their own medication in their room or in their drawer. A lot of times that's on a card, big cardboard card, where you punch out, it's labeled 8 a.m. and you punch out the meds for 8 a.m. And there's another card that's labeled noon and you punch out the cards from noon. So that's an individual medication supply. But the one that's most popular and that you're going to see the most is the unit dose medication. Okay. Your unit dose system gives you pre-measured, pre-packaged, and pre-labeled doses. Okay. There's pictures of them on page 351. Each one's individually packaged. It has the name of the drug. It has an expiration date. It's got the milligrams on it. Okay, even liquids can be unit dosed. You see the cups there in the back. Can't read what they are, but they're there. Or the little tubes with the albuterol for your respiratory treatments. Suppositories are unit dosed. Okay, those little vials there, those are called ampules, and they have 1 dose of medication in them. So the good thing about unit dose medications is that they are individually wrapped. It's easy to keep just a small supply in the room. You don't need to have a lot of meds. It's also, you can send them back to the pharmacy if they're not used. So if they change the meds, we're not wasting meds. We send them back to the pharmacy and get credit for them. You can take the individual packages to the bedside for your 3rd check. Remember, there's 3 checks for your meds. One, when you're looking at the supply, you compare it to the MAR. When you pull it from the supply, you compare it to the MAR. And at the bedside, you're going to compare it to the MAR. So it's easier to do your 3 checks. So it does save you time, because it takes a lot of time to get meds out of bottles. Individual meds out of bottles is ridiculous. All right, your prescription system is what happens when the doctor writes out a prescription. They take it to the pharmacy and have that filled. Okay. And that's part of that bubble pack that I was talking about. Oral controlled substances. Controlled substances, those are scheduled drugs, remember? And you are responsible for the management and security of those medications, no matter where they're at. If you have the key to the narcotic area, you are responsible. So never take a narcotic out unless you sign it immediately out of the book, because they are reconciled at the end of every shift. And if you are not on count, your count is wrong at the end of the shift, you're going to spend a lot of time chasing your tail trying to figure out where you gave that med. Okay? As you take it out of the supply, you sign it out. This is not signing that the patient took the drug. This is just saying that you removed it from the supply. Okay? Sometimes they have machines like on page 651, you have a Pyxis there, where you're going to go in, put the patient's name in, the drug you're looking for, the machine will open up automatically and give you those medications. Sometimes you have to count those drugs back because they're in a bin. And, you know, the good thing about that is we know who's been in there because everybody has an individual login. So we know who's been in there and we know which patients got drugs. Okay, any questions about medications? Let's look at the nursing process for our medication, okay? Remember, we do everything according to the nursing process. So application of the nursing process starts on page 652. So what are we going to assess? What kind of assessment needs to be done if you're passing medications?
The order for each
So we have to
medication.
look at the order, yes, make sure it's a valid order.
Vital signs.
Vital signs are important for a lot of medications.
Patient's
period.
name, drug name.
Katie, you gotta talk up, I can't hear you.
Oh, patient's name and drug name.
Okay, so we have to look at the patient name, the drug
Okay.
name. It's all there on the second column under application, assessment, data collection. On page 652.
If there was a med given before you checked the therapeutic level, or hold on. Therapeutic effect. I'm sorry.
Right, we're looking for this therapeutic effect of the meds. So if they've had a dose already, we're gonna see, are they working?
I was reading that.
Mhm. We're gonna check to see why they're on that medication. Remember, you have to have a medication, has to have a diagnosis to go along with it. Okay, you have to make sure that their NPO status, does that mean they can't have any meds? What did the doctor say? Okay. And then when we're doing topical meds, we're looking for adverse effects such as inflammation, swelling, redness, and discharge. So that's the assessment part of your nursing process here for giving meds. Each med needs to have a nursing diagnosis attached to it. Now, we're going to have our acute nursing diagnoses. Those come in when they do admissions. But then what if your patient is a diabetic? We need to have a nursing care plan for that diabetic. We need to have a nursing care plan if somebody has heart failure that are there for a totally different reason. We need to be taking care of the whole person, remember? So we have some examples of nursing diagnoses, which are part of the treatment plan on page 653. So if they're on pain medicine, then obviously they're having pain, right? If they're having high blood pressure and they're on antihypertensives, then our problem could be ineffective peripheral tissue perfusion related to increased blood pressure. All right, remember this is, we're looking at the nursing problem, not the physician diagnosis, okay? Imbalanced nutrition. If you're giving somebody who's throwing up, you're giving them antiemetics, then we're gonna have imbalanced nutrition because they're not gonna eat. So those are some samples of nursing diagnoses that go along with your chronic conditions, or even some of your acute conditions and your medications. Okay, so now we have our assessment done and we know our problems. We are going to start planning. Now, I know in planning, we're talking about expected outcomes, but we also have to plan how we're going to give these meds. Okay, so you gotta incorporate time for medication administration into your daily shift work schedule. And usually that's the first thing you do. When am I gonna give meds? When are my meds due? All right. And then you need to plan whether we need to take pudding or juice or crackers with us, because some of these meds need to be given with food. Some people have difficulty swallowing, so we need pudding or applesauce. We need water, we need insulin syringes, we need to make sure our cart is stocked, right? The overall goal, our expected outcome of medication administration, is that the medications or order will be safely administered to each patient on time, that will identify serious side effects, that the medication will be effective, there's no allergic reaction, the patient will understand why the drug is prescribed. Okay. And then there's the expected outcomes that go along with your nursing diagnosis about pain and vomiting and blood pressure. Okay. You can have expected diagnoses there. Then we get to implementation. And this is where we're going to actually administer the medication. Remember, you have to check 3 times and follow the 6 rights of medication. Always check for patient allergies before giving the med, and you document after you give the med. Do not document before. If the patient refuses the meds, we still put our initials on, but we circle the admission, the initials, because that means that they refused the med or we did not give the med for some reason. And it lets the nurse behind us or come in after us know that, yes, we did attempt to give this med. Otherwise, people think the med wasn't given or even tried. So you need to put your initials in every box. There's lots of different ways oral meds are given, or oral meds that are supplied. They can be tablets, they can be capsules, they can be spancels, they can be lozenges, gel caps, all those different types of oral medications. Okay. Make sure you give sufficient water when you're giving an oral medication, and that, remember, the water needs to be included in your I&O. You're going to go over administering oral medication. In fact, you guys went over it quite a bit last week in lab, those of you on the Tuesday lab. So we're going to go through that we're not going to go through that right now. But I do want to point out on page 658, there is a medication cup here. And when you are measuring a liquid in a medication cup, you need to do it at eye level. And at eye level, you're going to see a little curve because the cup is not flat across, okay? There's going to be a little curve, and that little curve is called the meniscus. You need to read it at the lowest point of the meniscus, and you guys will practice that in lab this week or next week, okay? When we're giving eye drops and ear drops, first of all, we have to remember which ones we're giving, okay, which ear they're supposed to go into. When you are giving ear drops, we want to make sure that if we are giving them to a child under the age of 3, we're pulling their ear down to straighten the ear canal. If we're giving it to an adult, we're pulling the ear up to straighten the ear canal so the drops can get down to where they need to be. When you're doing an eye drop, you want to pull down their can't say that word, conjunctional sac. Okay, right, just pull their lower eyelid down and put it in there. We're not gonna drop it from 3 feet up onto the eyeball. Some drugs are in spray bottles, atomizers, especially for nasal sprays. Okay, some drugs are in, so those you're just going to occlude one nostril and squirt and spray and have them sniff the medication back into their sinuses. But if they're doing nose drops, then you have to hyperextend their neck like they're doing on page 661. You have to have your neck hyperextended so that the nose drops will drain back into the sinuses where they're meant to be. Metered dose inhalers, okay. Metered dose inhalers are each time you take a puff, that's 1 dose. Sometimes you have 1 puff ordered, 2 puffs ordered, things like that. We're going to go through how to do that in lab, but if they cannot follow directions, they need to be able to blow out and then puff, push down on the inhaler and breathe in at the same time and hold their breath for about 10 seconds so that medication can settle on the bronchioles, right? If they can't follow those directions, then we recommend they use a spacer. And a spacer is that blue clear plastic tube with the blue ends on it on page 661. You puff the medication into the spacer and they just breathe in and out and they get the medication down where they need to go. We use that for children. We use it for people who are confused, people who can't follow directions. Vaginal medication, there are 4 reasons we give a vaginal medication. The first one is to cleanse the vagina in preparation for surgery. The second being to supply antiseptics to reduce bacterial growth. The third one is to remove odors or foul discharge. And the fourth is to apply heat or cold to soothe inflamed tissue or reduce oozing of blood. All right. So we refer to these vaginal irrigations that we're doing as douches. So that's just basically cleansing the inside of the vagina. There are different formulations that they use for that. You can also insert suppositories or creams and ointments into the vagina, usually using an applicator. And then rectal medications are in the form of a suppository. And usually we use those to prevent vomiting. If somebody can't take an oral med because they're vomiting, we're going to use a suppository to stop the vomiting. We use it to soothe hemorrhoids. Do you guys know what hemorrhoids are? Yeah, no, maybe? Yeah. Anybody experience hemorrhoids? Yes, they're not fun, are they? So we would put a suppository in to cool things down there, shrink the veins, which are causing the hemorrhoids. Okay. Prevent bladder spasms. There's a medication, belladonna, that we put in as a suppository, and it absorbs through the rectal wall and into the bladder wall, which are pretty close together. Okay. And then to reduce fever. Those are the types of suppositories you're going to run across. When you are inserting a suppository, remember, we do not want to insert it straight up because it may end up in a pile of poop, and it's not going to do any good in a pile of poop. Okay. When you're going to insert what position do we put people in when we're inserting a suppository?
Does it start with an L?
Mm-mm.
Is it Sims position?
Say it louder.
Is it the Sims position?
Sims position, yes. We're going to have them on their side. so that we can access the rectum, right? And when you put it in, you want to kind of angle it towards the belly button. And you need to get it past both sphincters. There's an external sphincter and an internal sphincter in your rectum. It needs to go up past the second sphincter, the internal sphincter. So you're not just going to stick it in there with the little bit of your finger there. Your finger's going to go all the way up in there to get that suppository where it needs to go. Running to the end here. Okay. When we're doing topical skin medications, we talked a lot about this, but remember that you're putting it on a intact area of the skin with no hair so that it can absorb correctly. If we're giving meds down a feeding tube, what do we have to do with them?
Crush them.
We need to crush them, or we need to recommend or get an order from the physician. You can't just change them. You have to have an order from the physician for a liquid. Liquids are always best on a G-tube, all right? All medication errors need to be reported. Everybody makes medication errors. It happens, okay? The goal is to keep your patient safe. You need to report them. You need to call the doctor and let them know so that they can give you orders on how to monitor or how to take care of the problem. You need to fill out an incident report so that your quality assurance group can figure out how it happened and how we can prevent it. And you need to carry out the orders the physician gave you. And, you know, yes, you will need to tell the patient and the family. Okay, that's 100% transparency. This happened. Okay, we're sorry. We're taking care of your patient, your loved one right now in order to prevent any side effects from this medication they received in error. All right. You're going to document that you called the doctor. You're going to document that you notified the family. You're going to document what your follow-up. You're going to document what's going on with your patient for the next 24 hours. Okay, we are not going to write what. What do we not put in the nurse's note? Ooh, we gotta go way back
Incident
to
report.
chapter. Right. We never write that we filled out an incident report, right? Other than that, we're gonna give all the information, but we will never write that we filled out an incident report. All righty. Let's do some cahoots. Okay, so get your phones out. I have a Kahoot. No, that's not it. I have a Kahoot for terms and abbreviations, which we all need to practice. Hello, it's taking me so long. Share the screen. Little technical difficulty, but we'll get. Okay, here we go. Come on. Thank you. There we go. There's like 20 of you here. We're having problems?
Professor Novak, I'm driving. I can't join in. I went to pick up my daughter from school.
All right.
I'll be home shortly.
Okay.
Thank you.
Okay, anybody else want to join? All right. So let's get started. You guys can join later if you want. Come on, where's my thingy? It's a problem with two different size screens. Okay. Come on. There we go, found it. So it's called, what does this mean? BID means very good, twice a day. Okay, LPN. Nobody got that? Oh, there we go. All right, it's just really slow today. What does TID mean? Right, 3 times a day. Don't get caught up in the T being twice. T means 3, try. Like tricuspid, triathlon, try. Okay. Seem to get a lot of lead changes on this one. True or false? AC means before meals. True or false? Oh goodness. It gave us the answer already. AC means before meals is true. Oof. Okay, EC on a medication bottle means Yes, enteric coated. I'm so sorry this is so slow today. I made problems last night. Okay, hold it. All right. See what happens when I make it smaller. The abbreviation for drop. What is the abbreviation for drop? Okay, GTT is the abbreviation for drop. Okay, I'm sure it has something to do with Latin. Get rid of some of this stuff, maybe it'll make it better. All right. And yet another new leader. ID in an order means, if you see ID, that's right, intradermal, it's an injection. We'll learn about those next week. What kind of injection is subcutaneous or subcut? Subcutaneous.
They gave us the answer.
Wait, what happened?
It flipped ahead. It's really flaky today.
Oh, I thought it was me. I'm like, wait, I did not.
No, nobody answered that one. Okay. QID means QID means 4 times a day. Very good, guys. Medication order says to administer medication SL. How are you going to give it? SL. Very good. Sublingual. PRN means? Give as needed. You all got that one. Medication states SR in the name. What does this mean? Very good. Sustained release. Okay. Slow release. Yeah, I can see that too. But the actual term is sustained release. New leader. Transdermal means. Now we're going to get into some terms. Absorbed through the skin. Very good. Where do you put a medication that is buccal? That's right, it goes between the cheek and the gum. A lot of good absorption surfaces there. Otic medication is given where? Otic. Yes, otic. O-T-I-C is the ear, not the eye. So what does it mean when we say log rolling? Yes, we're going to move the patient as a single unit to keep them in proper body alignment, usually if they have a spinal issue, spinal surgery, something like that. Argie's catching up. What does maceration mean? Yes, softening of the tissue when it's frequently wet. So people who are incontinent and have, urine sitting on the skin, if you have a dressing that's really wet, your wound or the tissue around the wound will become macerated. When a patient is in the prone position, which way are they lying? Prone position. How are they laying in bed? That's right, they're laying on their stomach, face down. Remember, prone is down, supine is on your back. Jazz is making a comeback. What is dangling? What does it mean when we say we're going to dangle our patient? Yes. We're going to put them on the side of the bed with their legs and feet over the side. Why do we do that?
Making
all
sure they don't
muted.
get dizzy.
So they don't get dizzy, right? So that their blood pressure settles down before we get them to stand up, right? Good job. Integumentary, what does that mean? The integumentary. Right, integumentary means the skin. Integumentary system is your skin. True or false? A patient with diaphoresis is warm and dry. True or false? Is that correct? That is false. What does diaphoresis mean? You're all muted, so if you're talking, I can't hear you. What's the meaning of diaphoresis? Those of you who said false.
Excessive sweating.
Right, it's excessive sweating. So usually they're cold and clammy, not hot, warm and dry. All right, RG finally took the lead. Good job. Where do you find cerumen? Cerumen. Yes, cerumen is earwax, guys. Cerumen, earwax. What assessment tool is used to predict pressure, sore, risk? We talked about it for the last exam. What's that called? Right, the Braden scale. Good job. Jazz is taking the lead. What is Eshar? Very good. It's that tough black covering over a wound. It's dead tissue. It's tough necrotic tissue that covers a wound. Remember, we need to get rid of that before we can find out what's going on underneath it. What is exacerbation? Exacerbation means that something got worse, an increase in the severity of the symptom. The last question. What does semifolars mean? That's right, 30 to 60 degrees. Good job, guys. I like it when you don't forget the stuff from the last test. Jazz ended up in 3rd place. 2nd place was V. And top of the board, RG. Good job, guys.
Last question got me.
It's the way it usually works. All righty. So I will. Yeah, you guys want to work on your 3 difficult questions were Saruman, Eshkar, and Odic. So that's a vocabulary issue, guys. All right. If you'd like, I will post that so you guys can practice. Would you like that in your
Please, I was gonna ask that as well.
Okay.
Yes, please.
Good. I will post that in announcements then. All right. So we have a little while yet. I would like to show you, hopefully I can get things to cooperate. I'm going to show you how the Swift River medication administration or the MedPass works, because we're going to be working in that soon. There's a lot of little details you need to understand.
Professor Novak, why did they change the whole quiz thing? So like we can't see what we got wrong.
Oh, I didn't realize it changed. I can change that.
Yeah, they do it now. Well, it shows now they give you one question at a time. And then once it's all over, it doesn't show you what you got wrong. It just
Okay, I'll
shows
open
you.
it up so you can see what you got wrong, and I apologize for the settings. I'll make sure the last quiz is set right, okay?
Yes, ma'am. Also, one of those questions was a select all that apply. But then when we seen it on here, it was one answer.
Okay, I'll look at it. See if I can give you extra points, okay? I'm all about giving you points on the quizzes, guys. All about it. And the quizzes should be a gimme. All right, so let me get into here. Hopefully when I share my screen, it won't be so slow. So I'm going to go into practice. Let me share the screen so we know what we're talking about here. Go into my dashboard. Okay, so I'm gonna go to practice. On your dashboard over here on the left, it says practice. And you guys can come in here at any time and practice. You can practice math, you can practice MedPass, you can play with any of these actually. But we're gonna go into MedPass today because this is what we're gonna start working on. So, and we're only gonna do one patient right now, okay? But we are gonna do all the MedPass for that patient.
We need to be following along with our own.
No, I just want you to watch.
Okay.
Because you're gonna be doing this here shortly, okay? So we're gonna select our patient. Our patient is Rita McKnight in room 304. Select your patient. Notice the time, it's 9 a.m. Rita matches her picture, her date of birth, and her medical record number, so we're gonna go in the room. So this is what your chart looks like. Make it bigger so you can see it. Okay, is that better? Probably too big. There we go. All right, so you have a time over here at 9 o'clock. Here's your patient. There are 3 different things you can check on based on what kind of medication you're giving. We have her allergies here. Her diagnosis is here. Okay, and this is her MAR. We are giving 9 a.m. meds. So we're going to look for 0900. Well, it's got quite a few. So the first one would be Flovent. Okay. It says 220 milligrams puff at 0900. We are going to select that medication. All right. There are no precautions on this medication, so don't need to give vital signs or pain or anything else. Doesn't have any labs. So I'm going to pick this med. And then it wants to know what category or what kind of med is this? And this is where you're going to start to learn those categories and what's going on with these meds, all right? So we're going to search by system because I know Flovent is respiratory. So then I'm going to go down here to find fluticasone. There it is. And we're looking for 220 micrograms per puff. So I have choices here. I have 110, I have 220, I have 440. Okay, I need 220 and it is a puff, so I'm going to select that. And doesn't say we have to give her more than 1 puff, so I'm going to give her 1 puff and I'm going to administer it. Yay, we're right. Okay. So, and you'll notice that that medication is now crossed off. All right. She has a 9 a.m. here, dextromorphan, Robitussin. What's that for? What does Robitussin do for you? Say it again, Aaron.
Cough suppressant.
It's a cough suppressant, right? So we're going to pick this medication. I'm going to search by system, and obviously if it's a cough, it's respiratory. And go to dextromorphan, Robitussin. We have 60 milligrams per 5 milliliter oral solution. Oral solution matches. We need 30 milligrams. Okay, so we're going to select that. So how much are we going to administer if we want 30 milligrams and we have 60 milligrams times 5 milliliters?
Can you say that again? I'm sorry.
Well, we want 30 milligrams. That's over here on our MAR. We have 60 milligrams per 5 milliliters.
Is it
2.5?
2.5?
2.5, yeah.
2.5 milliliters, very good. Okay, now I want to get my participants back up here. So we're going to administer that. And we're done with that one. Lisinopril, what's lisinopril for?
Blood pressure.
Blood pressure, okay? So it says patients, oops, we got interrupted. Okay, these are the annoying parts of MedPass. You get interrupted frequently. The patient tells you it's too cold, can you get me a blanket? Oh. All right, hold on. Okay. Can you guys see that? No?
No.
All right. Let's share the screen again. Okay. Just put this up there again. All right. So we have to take care of this before it lets it go anywhere else. So we have a choice. We have 2 RNs, 1 LPN, and 2 CNAs. Who are we going to send to get that blanket?
CNA.
The CNA. So we're going to select our action, request the CNA, submit, and we are correct. Where I get mixed up is the LPN RN one. All right, so let's go back to our Zestril, our lisinopril. Patient with a systolic blood pressure less than 110 should not take lisinopril. Well, what does that mean? It means we need to get vital signs, right? So let's get our vital signs. Her blood pressure is 117/72, so she can take this medication, right? So we're going to pick this medication. And we did say you can either do cardiovascular here, or we have an antihypertensive on this screen somewhere. There it is. Okay. Go down to lisinopril. We have choices. We have a 10 milligram, a 20 milligram, and a 40 milligram tab. Which one are we going to choose?
The 20.
20.
The 20, okay. How many tabs are we going to give?
1.
Okay. Very good. And you notice your vital signs are now up here on the top of your chart. Oh, goodness. Singulair. Monolute cast. Anybody know what Singulair is for?
Asthma, allergies.
Asthma, allergies, respiratory, right? Okay, we got choices. 4 milligrams, 5 milligrams, 10 milligrams. It says chew tab.
5 milligrams.
Right, because we can't give her 10 because that's just a regular tab. We need a chew tab. Okay, how many tablets do we have to give her?
2.
Very good. Good job. Yeah, so we got one more medication for 9 o'clock. Potassium, okay. Hold if potassium is greater than 5.0 milliequivalents per liter. How are we going to find that out?
Labs.
Yeah, we can get the lab. Her potassium is 4.7. Okay, so she can have her potassium. We're going to pick this medication. Yep. You hear a patient saying someone needs to clean my room. We have 2 RNs and an LPN and no CNAs. Who's going to clean the room?
RN.
LPN.
Yes, the LPN. Okay. Okay, it's an appropriate action when there's no CNAs available. It goes down the pecking order, right? So I'm going to pick our potassium. Easiest way to find that is by category here, because we have vitamins and minerals, and potassium is a mineral. So we're looking for K-DIR 20 milliequivalents capsules. We have Cater 10%, 1 milliliter oral solution, Cater 10 milliequivalents capsule, or Cater 10 milliequivalent tab.
The 10 milliequivalent capsule.
Very good. How many capsules are we gonna give her? We want 20.
2.
2. All right. Let me get all the 9 o'clock meds here. Okay, but she has a PRN, and every time we come into a room with somebody who has a PRN, we need to check to see if they need their PRN. So Lortab is a pain medication, so we're going to check for pain. She's got 5, okay. This would be, let's select this. It says administer when pain level is moderate to severe, or pain level is a 5 out of 10, which makes it moderate. So we are going to pick this medication. It also says patients allergic to opioids should never take hydrocodone APAP. She doesn't have any drug allergies. So pick this medication. All pain medicines are neuro. We're looking for hydrocodone, APAP. There it is. 5 milligrams, 325 tablet. I have 7.5 oral solution. I have a 10 milligram, 500 tablet, a 5 milligram, 325 tablet. Which one?
The 5 milligram 325 tablet.
Mm-hmm. Okay, how many tablets should she get?
1.
Okay. So we have finished all our med pass. We've given her all her 9 o'clocks, and we gave her PRN. So let's finish administering. So now we're going to come back out, and it is noon, and we're going back into Rita's room to give her medication again. She hasn't moved. She's still there. What meds do we have for 12 o'clock?
The first one.
Okay. Alprazolam or Xanax. Okay. Causes respiratory depression. So what do you think we need to check?
Vital signs.
Okay. Respirations are 15, so I think we're okay there. Let's pick this med. It'll be a neurological because it's a psychiatric med. There we go. Alprazolam, we want a 0.5 milligram in a tablet form. So I have 0.5, 1 or 2. Which one?
0.5.
Okay, how many? Patient telling housekeeping, I need to see a nurse. That's a tricky one. Which one do you think we're going to send? We have 1 LPN and 1 RN.
LTN.
Very good.
So why not an RN? I mean, why would that be either one?
It would be
right or
an
wrong?
LPN because we don't know what the problem is. Okay, if it was something that's stable, the LPN can take care of it. Okay, so the hierarchy on the unit is the RN, the LPN, and the CNA. Okay, the RN directs care, the LPN generally takes care of all your stable patients, and the RN will take care of those that are unstable. Okay, so we're looking for 0.5 milligrams. We have 1 tablet. This was 0.5 milligrams, so we're going to give her. One tablet, administer. Anything else at noon? 12 noon.
You would do the PRN again.
Let's check the PRN again. So it's moderate to severe. Let's check her pain assessment. She's mild now. Does she need her medicine?
No.
Okay. So we will hold on that. and finish administering medication. At 1,500, she has some more medicine. What does she have at 1,500?
The Robitussin.
The Robitussin. 30 milligrams, oral solution. Respiratory. Oh, there we go, dextromethorphan. Okay. So she needs 30, we have 60 per 5 milliliters.
2.5.
2.5, administer. Very good. Anything else at 1,500? No. So we just have an 1,800 and a 2,100 left. Okay. Oops, we didn't assess the pain level. It won't let us leave. No pain. We're gonna hold.
Oh, so when you're passing medications like in real life, and you have a PRN medication, and so every time you pass meds, you see if the patient needs that medication. If they don't need it, you still initial and then circle saying that
Not for PRNs. We only initial PRNs when we give them. Okay. It's not like a routine med. PRNs, when they need it, we sign it out. But we always have to inquire if they need it. Okay. All righty. 1,800. We only got a couple more to go. What did she get at 1,800?
Buspar.
Buspar, yes. All right. No drug precautions, so we don't have to worry about anything like that. Let's pick this medication. Buspar is a psychotropic type medicine, antidepressant, anti-anxiety. Patient in another room states the TV is too loud. We have one CNA and one RN. What are we gonna do?
Request a CNA.
Yes. Okay. So Buspar, we have a 10 milligram tab, a 30 milligram tab, and a 5 milligram tab. Which one are we going to give her?
5.
How many are we going to give?
1.
Oops. That wasn't what I wanted. Hit this green button. Okay. So I think that's all for 1,800, but what do we need to check before we leave?
Pain.
Still at 0. We're going to continue to hold. And then last but not least, at 2,100, we're going to go back to Rita. Rita gets meds all day long. You notice that? It's not like you just give it to them in the morning. 2,100. Celexa.
Alexa.
No precautions. Pick this medication. What kind of med is Celexa? Does anybody know? It's an antidepressant. So what category or system is it going to affect?
neurological.
Very good. Citralazine. Housekeeping tells you the patient on the other hall states they can't catch their breath and needs help. Who we sending?
RN.
RN.
LPN.
Remember, they can only take care of stable patients with predictable outcome. We don't know what's going on, right? Could be wrong, but I think it's the RN. Yes, it is. Because we don't know what's wrong. If this was somebody who had this problem, all the time, or something we've already treated, then the LPN can go down. But if it's something that needs to be checked on for the first time, it's the RN. All right, citalopram. There we go. Celexa. We're looking for 20 milligrams oral solution. Yeah,
The last one.
Last one, yes. So we want 20 milligrams. We have 10 milligrams per 5 milliliters. How many milliliters are we going to give her?
10.
Okay. And what do we have to remember to do before we leave? Oh, nope, there's another one. In addition to her Celexa, she's going to get a Zolpidem or an Ambien. Hello, excuse me. Hi. It's in the business office. If you couldn't take him down to where the new lab is down in the business office.
You'll know what it is.
It's a big box.
Okay.
Thank you. You're picking up the old stand. Okay. So this causes respiratory depression. What are we going to look at?
Vitals.
All right. See how she's breathing today. Respiratory rate's 28. Sounds like she needs something, right? Let's pick this medicine. What system?
Neurological.
Respiratory.
Or respiratory? No. Ambien is a sleep medication. So we're looking for 5 milligrams oral spray. Never given it that way. So we have a disintegrating tablet or dissolving tablet. That's what DIS means. Oral spray or a tab.
Second one.
Oral spray.
Okay. And she needs 5 milligrams, and we have 5 milligrams per spray. How many sprays is she going to get?
1.
One spray. And then once again, I think we're done with our 2100s. We're going to check our pain is 0. So we can just leave.
The big long one?
The big long one.
The thing on top go?
No,
Just the big long box.
big long box. Thank you. All right. So how did we do? We got 97%. Good score. Okay. We got 1 wrong because we didn't check the pain. That's all we did. Okay. So we will be getting assignments in MedPass, but I wanted to go through that with you guys so you could see what's going on. So let me finish sharing. Dean Smollenberger and Mr. Gibbs will be in about 10 to 12, so we have about 20 minutes. Do you guys want to play? You want to go in and do MedPass for 20 minutes? You can go into, what do we got here? We can start. I finished it, that's why it's not here. So I'm gonna pass that, lab week 7. Okay, go to lab week 7. I'm pretty sure this is the one I'm looking for. Yes, okay. This is MedPass, all right. And you will have to select your patients over here.
Can
So,
you explain how to get there again? I'm sorry.
okay, you're gonna go to your dashboard. And you're going to check, and it's PNR 104 lab week 7. All right, we have 5 patients, and then hit start. And at 6 a.m., when you pull your patient down, you only have one patient there. So you're gonna go into room 306 and pass her meds. All right? So we got about 15 minutes. Let's see where we're at, okay? See where we're at when Dean Smollenberger shows up. So I'm here if you need any help.
I do have a question. Professor Novak? Can somebody just explain to me how to get to the website that she's talking about?
Just go in swiftriver.com.
So you just type it in the computer, right? Like
Yep.
it's not like a link.
Yeah, it's just type it in. It's like learn.swiftriveronline.com.
Okay. Thank you.
Yep.
Are you supposed to like create an account, or do we already have an account?
Did you create one when we first started doing them?
I think so, but I don't remember how I got to it the first time.
Let me think. Because it takes you to like this.
Giving us another assignment on there, but I don't remember if I knew I had to make an account, but I don't know how to log in.
Like you don't remember what you put, because it's normally your school email for like your username or whatever. And then after your school email, then maybe you can just press like forgot my password, you know what I'm saying, and reset it.
Okay, let me try that.
Okay, let me know if it don't work.
How you guys doing?
Okay.
Good.
Okay, I got it, Aaron. Thank you.
You're welcome, sugar.
Okay, hold on.
Ms. Novak, what category would Cipro be? Cipro is, I picked urinary, but
It's an antibiotic.
okay.
So if you go back into the second one, the first box, you'll find antibiotic in that one.
Oh, I was thinking like for like bladder infections.
Right, but it's given for respiratory infections too, so.
Okay.
Miss Novak, I have a question.
Yes.
So for this one, we're supposed to go on Swift River, right?
Yes.
Okay, so I'm on the student dashboard
Yes.
and I'm trying to see which one exactly. It just shows me
It's lab week 7.
week 7.
Mm-hmm.
Okay, lab week 7. Got it. Thank you.
You're welcome. Okay, guys, Mr. Gibbs is on his way in, so please log out of Swift River and turn your cameras back on. Log out of Swift River and turn your cameras back on. We're just waiting for Dean Smollenberger now.
Do we still have lab this afternoon?
Lab is at 1 o'clock on campus for Tuesday lab, okay? You'll be out of here in plenty of time. So how far did you get in Swift River? Did you get one patient done? Nice. Good job, Vanessa. You guys remember you have NCLEX homework due on Friday by 8 p.m. We have an exam next Monday or Tuesday. Exam 3 is next Tuesday. It is on chapter 33 and 34. Okay. all medication pass at medication administration. There will be some math on that. Well, there's probably quite a bit of math on that exam because that's a large part of medication administration, okay? So math tutoring is on Wednesday online at 1 o'clock, in the building at 2 o'clock, Friday afternoon at 4:30. We can also do math tutoring. And if you need help in between any of those other times, you need to call me. And I will be glad to set up an appointment with you, okay?
Wednesday at 1 is definitely online.
Say again?
Wednesday at 1 is definitely online for tutoring.
Wednesday online at 1 o'clock?
Yep.
Yeah, go to the office hours link.
Okay, thank you.
Okay. Hello, Mr. Gibbs.
Hi, Professor Novak. You got
How you-
everyone here?
Yeah, we
Okay.
do.
Well, I'm going to go ahead and get started because unfortunately I have another a meeting and I don't want to, I'm not sure where Dean Smallenberger, I think, got tied up with the students. So anyway, hello, everyone. I recognize some of you out there that I was able to talk to when you first started, when Dean Smallenberger and I met with you guys in small groups. So some of you I recognize. So anyway, I just wanted to pop in today. I'm just going to literally take a few minutes. I just want to kind of give you guys a little bit of a pep talk. You know, when we talked when you guys started, you know, we talked about, you know, nursing school is going to be tough, and we really needed to be a bit selfish in, you know, our situation at home, and having, you know, others, whether it be boyfriend or girlfriend or kids or whatever it might be, with them helping out and making sure that you guys have time to study, and making sure that you guys have really planned your work hours and those things around your nursing school. So I know that you know, that was discussed in orientation and so forth, but I just wanted to kind of pop in at this point. I know that for a lot of you, your grades aren't where they need to be, and we need to get you guys on track. I know Professor Novak's been working with you. So I just wanted to kind of come in. Dean Smallberger probably will be joining me, and just remind you guys, you know, all of you guys did this to change your lives, right? All of you, that's the whole point of doing this, right? You want a different life than the life you had a month or so ago. Am I right? Give me a thumbs up if that's what you guys, that's what I thought. I'm usually right about things like that. So we really need to make sure that happens. So class is kind of hard, right? Nursing school, is it hard? Yeah, I got that three heads shaking. It's hard. I went to school for a long time, you know, and I came from a single mother household, and she was struggling to keep food on the table and stuff. And then I went to college, and you know, I had to work, and I remember it's hard. I went for many years, and it's hard, but I was really fortunate. I had a great support system, and my mom, very, very proud that she's the first one to go to college. So she really pushed me. And maybe some of you guys have found out that you just really don't have that at home. And I know you have it with Professor Novak, and you certainly have it with myself, Dean Smallenberger, and the team. But you guys need to use it. You guys need to use the resources. So really kind of just putting it out there that if you guys aren't making sure that you're at class, making sure that you've come up with extra time to study, making sure that you're taking advantage of any reviews or remediation or anything like that, you guys have to do that. This is a big investment. Is school expensive? It's expensive. If you didn't know, I'll tell you today, or it'll be earth shattering. It's expensive. It's expensive any school, but nursing school is definitely not cheap. And you guys are making a big investment, and you're putting your time in as well. And we need to make sure that you're successful, because if you're 2-3 months in and you guys, you know, it doesn't work out, then you don't have anything, right? It's like driving half a car. You've heard me say that before. It's just worthless. So we just really, really need you guys to just, you know, you're just going to have to step it up. Some of you that your grades aren't where you need to be, you're going to need to lean on Professor Novak and listen to her and take her advice. But at this point, I mean, you really, really have to do it. It can't be just thinking about it, or I'll do it next week. It really needs to start today. We just really need to get, you know, some of you guys, your grades are really at risk. You guys do know that if you fail a class twice, you're dismissed from the program, and that's it. You can't come back. Did you guys know that? Okay, well, some of you are, you know, some of you are in a situation where that could potentially happen, and we don't want that to happen. Our goal is not to have students start the program and not succeed. You know, we have had phenomenal pass rates with our NCLEX. We're very proud of those. We have amazing success stories out there in the community of students, you know, especially PN students. Do you guys know the job market for PNs right now? It is phenomenal. Like I'm 54 years old. I've been doing this about 35 years. I've never, ever seen the PN job market so hot. I mean, the jobs are just amazing. We want to get you guys out there and get you to the, but you guys got to sacrifice now. So I'm just really challenging all of you guys that starting today, that you guys really make some changes in your study habits. You guys really putting the time in. You guys should be putting in 3 hours to every hour that you're in class. You should be putting that into studying at the minimum. I stay close to this. I talk to Dean Smallenberger a lot. She speaks to your professor, and I'm going to be asking. I want to know if you guys are going to your reviews and taking advantage of, office hours with Professor Novak and so forth. Because if you're not, you're really throwing your money away. It doesn't make any sense. You guys all came in. You guys were committed to this. I think you guys have, I'm hearing good things about you. You guys want to succeed. Some of you are doing really well, and congratulations on that. And some are struggling a little bit. And I certainly struggled some in college. I remember that. That's not fun. But boy, I wanted it so bad that I made it happen, and I sacrificed. And, if I was dating someone, I told them, look, you're probably not going to see me much for a while. I worked, but I took my hours down. I did what I needed to do because I knew if I didn't get that degree, I was not going to change my life. I was going to have the life my mom had, and my mom didn't want me to have that life. And I ended up not having that life because I stuck with it. And Professor Novak probably can tell a similar story, as can Dean Smallenberger and a lot of other people. But it's really about buckling down and just really saying, this is what I want and this is what I'm going to do. We've got resources in the Success Center, along with your professors and your deans and your associate deans and myself. You guys have plenty of people. If you're not sure what that looks like, if you're not sure what exactly do I need to do to be successful, speak to those people. Start with Professor Novak and speak to your dean or your associate dean, speak to your success coordinators. And again, make sure that you're attending those reviews and those remediations. They're just so critical. We do things at this campus I've never seen done anywhere else. They're just phenomenal. And the resources are just amazing for you guys. But I'm noticing a lot of you guys aren't taking advantage of them. And we really need to do that, okay? So I don't want to sit here and preach at you guys. I do it out of love. I want you guys to be successful. I'm super excited for you. You guys are going into a field that's just amazing. And as I said, the positions we're seeing and we're filling with our grads and the pass rates that we're seeing are super. We just got to get you guys into some really good study habits, have you guys be committed, but just understand that, unfortunately or fortunately, there are rules. There are very strict rules in nursing school. Okay. And once those rules, if you hit those rules, and you fail a class, or any classes 2 times, I mean, you're just out of the program. And I do not want that to happen to anybody on this call. And I know you guys don't either. And I know Professor Novak doesn't want that either. So anyway, just really kind of a pep talk for you guys. I know you guys can do it. I know how excited you guys were when you started. Just, bring back those, whatever it was that made you want to do it, whether it be for yourself, your family, or whoever. Just go back, dig deep, remember why you did it. Remember what that was about for you. Dean Smallenberger often says, find your why. Go back and find that. Spend some time on that today, and then, starting today, just make those changes, okay? But lean on my team to help you with those changes. All right? Well, listen, I know the last thing you need is anyone preaching at you, so I don't want to sit here and do that, but I do care about you guys a lot, and we really want to see you guys successful. All right? So don't hesitate to reach out, and again, start with Professor Novak, okay?
Thank you.
You guys gonna do it? You guys gonna get through? Thumbs up?
Come on.
All right, good.
Little
Good, good, good.
enthusiasm here, guys. Come on.
It's a quiet group. That's okay.
It's a very quiet group.
Yeah, no, that's all right. All right, guys, I really care about you guys. If you need me, you know how to get a hold of me as well. Thanks, Professor Novak.
You're welcome. Thank you.
All right, bye, everyone.
Bye. Okay. So there's your marching orders. We need to pick it up. Some of you are doing well, and I'm not going to take that away from you. Everybody could do a little bit better, but some of you are doing well. But the rest of you need to pick this up, okay? Show up for office hours. I will go over math. I will go over content. We have reviews for on Monday, Friday on campus, 1 to 3, and Monday, 1 to 3 on Zoom, okay? For the exam that you're going to take on Tuesday, okay? So we have to please fit this stuff into your schedule. I know it's hard. But we have to fit this stuff into your schedule. All right. I don't know where Dean Smollenberger is. She's probably tied up with another student. Okay, so we have lab on campus for those who have Tuesday lab. You're gonna have lab on campus 2 weeks in a row because we got snowed out last week. All right. Make sure you're in uniform when you come to campus. Okay. Next week when you come to campus, they are having, the bookstore will be open a half hour before lab so that you can take care of any uniform issues you may have. I had a lot of people whose uniform didn't fit, and so they weren't wearing it. We got to have a uniform on. We got to have a uniform that fits. You need to make sure you have your white shoes. If you're going to wear boots in, you got to change them into white shoes. Okay. So I will see some of you very shortly. The rest of you I'll see on Thursday. Okay. Work hard. All right. Keep your head up. You can do this. We have a lot of points left to give. Lots of points. All right. And most of you did much better on the second exam. I'm expecting you to do really good on the third exam. All right. Okay, guys, I will see you all whenever. Tuesday, Thursday, it's afternoon. Have a good day. Okay. All right.
Do we have lab on Thursday?
Lab is online on Thursday.
Online. Thank you.
Okay.
Hi, Prof.
Yes.
I do have a situation I want you to help me out.
Yes.
So my son had messed up my laptop by pouring water onto it, so I can't even get access to it. So right now I'm using my iPad, which doesn't have the exam socks. So I was wondering if I get, I'm trying to fix it, okay? So if I'm not able to fix it by the time, can I come to campus to do the exams?
Absolutely, you can come to campus
On the same day, right?
Yes, we have a computer set up with exams off, so
Okay, then I can do that one.
that'll work.
Okay, thank you very much.
You're welcome. Anybody else?
And also, I have a question too. I'm sorry.
Yes.
So for the troubleshooting thing for the exams office tomorrow at 4, right?
Tomorrow at 4, and I will send you the link.
Okay.
Where is it?
All right. Thank you.
Okay.